Good afternoon, everybody. This is Congressman Adriano Espaillat, representing the 13th Congressional District. With us, we'll have Assemblywoman Carmen de la Rosa from Northern Manhattan and Councilwoman Diana Ayala from East Harlem. I don't want to leave the program, Assemblywoman, without talking a little bit more about mental health, because I know that you have been a real advocate for that. Could you just share some ideas on what the program that's about to be launched entails for the 13th Congressional District, the mental health program?
Absolutely. Well, with the leadership of the Congressman and New York Presbyterian Hospital, Columbia University, there has been real leadership in creating an initiative that will intervene in moments of crisis for our communities. We have a crisis intervention team that is going to be put on the ground to make sure that our community has access to quality mental health services during this time. But in addition to that, there's also going to be an online program that will also be facilitated through this initiative to ensure that things like, for example, talking about depression, talking with a teenager about suicide or suicide prevention is also something that happens in our communities and will be done virtually as well. So we are excited about the launch of this initiative and ensuring that true access is given for mental health services in minority communities of color.
We will probably be facing a mental health tsunami. People were unable to say goodbye to their loved ones that they lost during the pandemic. People lost their jobs. All of this now is sort of like a perfect storm, and we will see a mental health tsunami. What can you share with us, Councilwoman?
We saw that virtual telehealth services were actually very successful way of psychiatrists offering, or even counselors continuing to service their patients. However, there still continues to be a long wait period for accessing mental health services because we still continue to have a shortage of mental health providers. We have been really advocating to ensure that those services are available to children in schools, because we know that with remote learning, it becomes a little bit more difficult to access those resources. And we have been working also with the administration in trying to figure out some sort of on-site mobile resource that would be available to individuals that may be chronically street homeless right now, that may be suffering from chronic mental illness that's untreated.